Hello, my name is Amy Francie. Today I will be presenting my evidence-based practice proposal, a comparative analysis of psychotropic medication, behavioral therapy, and combined treatment effectiveness in children and adolescents with autism spectrum disorder. This project is guided by the Iowa model of evidence-based practice and aims to provide real-world, long-term data to guide treatment decision-making for this population. The purpose of this project is for children with autism spectrum disorder. They often experience behavioral challenges that can significantly affect their daily functioning and their quality of life. Families and providers face difficult decisions when choosing between medication, therapy, or both. Currently, there is no clear gold standard for determining the most effective approach, which can lead to delays in implementation of the best treatment. The purpose of this project is to compare the effectiveness of three approaches: psychotropic medication alone, behavioral therapy alone, or a combination of both, in improving function, reducing behavioral symptoms, and increasing caregiver satisfaction. For the literature review, background and significance. Autism spectrum disorder is characterized by social communication difficulties and restricted, repetitive behaviors, often accompanied by aggression, irritability, or self-injury. Psychotropic medications like risperidone can reduce severe behaviors, but have notable side effects, like sedation and metabolic issues. Behavioral therapies such as ABA and CBT improve adaptive skills without pharmacologic risks, but access and consistency can be barriers. While both approaches have proven benefits, research directly comparing them, especially like in real-world long-term settings, is limited. This evidence gap is where my project focuses. The evidence to support proposed change. Research shows medication works quickly for symptom relief, but may not sustain long-term gains. Behavioral therapy offers durable benefits, but can be slower to show change. Combined therapy appears to provide the fastest symptom improvement and highest caregiver satisfaction, but the research is limited in real-world settings. By running a 12-month head-to-head comparison, this project will fill an important evidence gap for families and clinicians. The proposed change or intervention. The project will compare three treatment groups: kids that take psychotropic medication only, kids that do behavioral therapy only, and a combination of both. The goal is to not only determine which is most effective, but also to assess how combined care may offer synergistic benefits. By implementing and evaluating these interventions in real-world pediatric outpatient clinics, we can generate practical, applicable evidence for everyday clinical practice. For the methodology and ethics and data collection, I will be obtaining IRB approval, making sure that HIPAA is complied with at all times, and make sure that the participants know that their participation is completely voluntary. I will be doing assessments at baseline, 6 months and 12 months, and blinded evaluators will use validated tools like the Aberrant Behavior Checklist, and then surveys via in-person or secure telehealth will be obtained. For outcomes and evaluation, the primary outcome will be changes in daily functioning, measured by the Vinland Adaptive Behavior Scale, 3rd edition. Secondary outcomes include reductions in behavioral symptoms using the Aberrant Behavior Checklist. Caregiver satisfaction will be measured through a validated Likert scale survey, and medication adherence in applicable groups. Data will be collected at baseline, 6 months, and 12 months using both in-person and secure telehealth formats. Evaluators will be blinded to group assignments, and strategies like reminder calls and flexible scheduling will help maintain participation. I will use a repeated measures ANOVA to analyze changes over time within and in between groups, allowing to identify both statistical and clinical significance. In addition to the quantitative data, I will also analyze caregiver feedback to identify common experiences, behavior, barriers, and facilitators of success. This mixed approach will give us a more complete understanding of how each intervention impacts families and patient outcomes. The most successful approach will be defined by meaningful improvements in functioning, manageable side effects, and high caregiver satisfaction. the significance to nursing and innovation. The project has the potential to fill a critical evidence gap in autism spectrum disorder care and inform both practice guidelines and policy decisions. For nursing, it supports family-centered, evidence-based care and encourages collaboration across disciplines. Its innovation lies in combining real-world implementation with rigorous outcome measurement, helping bridge the gap between research and daily practice. These findings could shape care pathways, improve access, and enhance the quality of life for children with autism spectrum disorder and their families. This slide lists the primary studies, systematic reviews, and methodological references that informed the proposal. These sources form the evidence base for the proposed change and align with the Iowa model framework guiding this project.